Hi, future doctors. I'm Dr. Salam Hamdi, anesthesiologist intensivist at Sahlul Academic Hospital, associate professor in anesthesiology and intensive care, affiliated to the Faculty of Medicine of SUS. In this video, I will talk to you about the importance of the early recognition of sepsis. In other words, we have to spot sepsis before it hits. To produce this video, I co-worked with my colleague, Dr. Rawda Shrigi, whom is anesthesiologist intensivist at Sahlul Academic Hospital. Also, she is associate professor in anesthesiology and intensive care, affiliated to the Faculty of Medicine of SUS. As an introduction, you have to know that sepsis often starts subtly. Patients may look stable, but deterioration can be rapid. Relying solely on fever, hypotension, or labs is too late. Early recognition depends on physiology and bedside scoring systems. The key early signs of sepsis are: first, the mental status changes, confusion, agitation, and drowsiness. Perfusion indicators: the patient might be pale, with cold extremities, having delayed capillary refill. Vital signs trends: rising heart rate, blood pressure drop, tachycardia. Other clues: decreased urine output, mild lactate elevation. Basically, there are two bedside scoring systems: the quick sequential organ failure assessment and the National Early Warning Score 2. To calculate quick SOFA score, we use three criteria: the respiratory rate, the altered mentation, and the systolic blood pressure. To calculate the NEWS2 score, we use 6 physiological criteria: the respiratory rate, the oxygen saturation, systolic blood pressure, heart rate, level of consciousness, and temperature. Added to these 6 physiological parameters, the need of supplemental oxygen is also checked. To note here that SIRS, or the systemic inflammatory response syndrome, is no more used because it is not sensitive, neither specific. You can see here the summary of the two scores, the quick SOFA and the NEWS2 score. In the case of quick score, if the score is more than 2, there is a high risk of having sepsis with poor outcome. And for the NEWS score, if the aggregate score is more than 7, there is a high risk that the patient presents sepsis and we have to act urgently or even emergently. In conclusion, you have to capture these teaching points. Always observe physiology first. Use quick SOFA or NEWS2 scores to quantify risk and trigger action. Lab values such as lactate, white blood cell, cultures support, but do not replace clinical judgment. Early recognition saves lives, meaning your eyes, your ears, and your clinical reasoning are the first monitors. Thank you, and meet you again in other future videos.